All right. Hi guys. This is Daniel Swastegi,
My name is Chris Ottinger.
My name is Nathan Lara.
I am Nathaniel Chandler.
And my name is Blanca Gutierrez.
and our project is about computers and their applications in medicine. Now, to start us off, we're gonna introduce Blanca.
So computers in the medical field. Next. So computers in the medical field was started with Javon Weiner in 1949. Was established the first professional organizational for health informational in Germany. Health informational is a discipline of intersections of information such as science, computer science, and healthcare. It's concerning with the research device and method requires for obtaining, storage, retrieving, and use for information in health and biomedicine. Computer technology is in medicine begins in the 1950s, rising of the computers. Health informational tools include computers, clinical guidance for formal medical terminology and information and communication system. It applies areas such as nursing, clinical care, dental, pharmacy, public health, and therapy and biomedical research. With the informational training program, it begins in 1960 with France, and then it leads up to the United States in 1970. So in 1970, we actually had the health informational resources to see further details with patients. Next. What is computer science in the medical field? Computer science in the medical field is all types of data search, storage, such as sharing information containing medical tests and stimulating complex surgical procedures. So the types of data that the medical field keeps track on will be storage of patient data of health information, computers insertional procedures, computer technology and diagnose tests, and computer and knowledge sharing. Next. So storage of patient data and health information. Hospitals employs computer systems into patient records. So doctors require about information about patients' family history, physical ailments, in diagnosis, and prescribed medication. Computers keep all tracks of prescriptions and billing information. Computers collect all medical journeys, research, diagnosis, papers, important medical documents referring to the books can be the storage in the electronic form. Next. Computers and surgical procedures. Computer software is used to diagnose the diseases by examining internal organs of the body. So computer assisted surgery is fast advancing field in the medical model of the patient creating their priority into the surgery. So the surgical procedure stimulates the vertical imaging of the patient. So the surgery can perform by surgical robotic or professional surgery. So sometimes the doctor and the robot will be doing a same type of procedure within the same moment, or sometimes they will just have like other doctors and other surgeons, as you can see on the picture below. Next. Computer technology and diagnose tests. Medical imaging deals with requiring creating imaging of the human body and medical purpose, such as scanning and imaging into the computer technology. Magnet resonance imaging improves computer software. The computer tomographically makes the geometry between 3D to popping out 3D. So sometimes doctors would have like an imaging of the heart. Sometimes they'll take it out from the screen and it will make it 3D. So they could actually rotate it, or they could actually see it in the screen like TC scan. So they could actually see your brain and see what's going on. And many medical appliances as today will stick into the pre-programming. So meaning they would just get into further details on the screen. And this leads into the functions of the hospital bed, beeping system. So many of us will go to the hospital and sometimes we'll hear all these beeping noises in the room. Usually that applies for many reasons of the things that I didn't even know. Usually if patient needs assistance, they will put this nurse assistant, and then they do have the emergency alarm. So patient knows what button would it be when doctor, nurse will come rushing if it's like 911 reason. Also, this leads on to x-rays. So many of us, I'm pretty sure we all had like an x-ray at one point, and it's pretty crazy how they get your 3D of your lungs or your leg, and then usually at the time, and you can see what's going on. And a lot of medical applies, applicants actually applies onto this reasoning of the diagnose test. Next. Communication and knowledge sharing. So computer technology eases the communication between medical practitioners and patients, sharing of knowledge and pertains into researching and updating of the medical field. So each day our technology is getting better over time. So in the medical field of medicine and in general in the medical field, a lot of doctors and patients like collaborating even until today, until COVID. So I know many of us will either FaceTime with the doctor or we'll have like a phone doctor visit just because technology has been growing in the medical field, or else we won't be seeing any doctors. But now doctors are kind of seeing other doctors overseas from having like a whole conference meeting. As you can see in this picture, we have like a surgeon doctor, then another doctor in different locations. Usually this is a form of like the best communication that doctors have over computer science, just because they could see other diagnosis tests or researching about their own particular patients. And this is an update of the medical field advancing in their medicine and information about their new method and treatment. We can have this in common and have the internet and an easy access to the computer.
Computers in the medical training. So on the next slide, computers are being integrated in a whole bunch of different ways, especially in the training. The old methods of training really involved, for some of the training, it had mannequins, but most of these mannequins were just lifeless dolls that were anatomically correct, but they provided no feedback for the students or the professionals. So these new generations of mannequins are being integrated with computers and new technology, and they're being offered at medical schools, hospitals, and military centers, both for students and the working professionals. And they're really helping improve people's skills and reduce the errors without the risks to patients. And on the next slide. Some of the technology and features that are being offered compared to the old generation is that these new generations with computer controlled features, they can do everything from like having a seizure so they can move around and eyes can roll in the back of their head. They also have breathing and chest movement. They also can talk back to the student or professional with, slurred speech or coughing or pain vocalization while their body's moving. And also the computer controls things such as blood flowing through artificial veins and arteries. So the students can work with IVs and blood transfusions and stuff like that. They also have a heart rate and blood pressure so that you can monitor those and check their vitals. So you can see their heart rate, blood pressure, blood oxygen levels. And they're also anatomically correct with organ, skin, fat, muscle, and bone all simulated. And most of these, some of them can be programmed, but most are controlled by an operator. So they'll have like an iPad where they can push the buttons to make them cough or make them talk or make them move around. And on the next slide, the military is also using these for training. So they'll start learning in the classroom about these new generation of dolls or mannequins, and they will be taught how these dolls can also provide simulations of the blood flow, breathing, heart rate, and they can simulate combat wounds such as ruptured artery, a gunshot, or missing limb. And on the next slide. But a new generation of computers being integrated is the virtual reality trainers. Now, it's an emerging field, so it's fairly limited, but it's a new way to teach nursing students and the professionals, such as doctors, along with treatment for patients. So the nurses and doctors can perform things such as the top picture here you can see is somebody intubating a patient, so you can get a nice in-depth view of what's going on in there. The doctor can see scans in 3D and have more comprehensive idea. And the therapy for patients can reduce stress and anxiety when it comes to being at a hospital. And these new generation of virtual reality trainers, it's going to be provides very high definition video and audio feeds, and will really help improve the way doctors and nurses are trained. And that's it for training.
Okay, next is computers in laboratories. Next slide, please. So the main purpose of clinical laboratories is to provide accurate test results for a patient within a short amount of time. The way this is done is by having a computer do a large amount of the grunt work. This allows laboratory analysis on a patient to be done much faster than ever before. Next slide, please. One of the key features is the Laboratory Information System, or LIS, and this is in full effect from the moment a patient is checked into the hospital, right? LIS is a computer software program that processes, stores, manages all the data from all the stages of the medical process and tests. It is a crucial part of how physicians and lab technicians operate in the modern daily medical field. They use the LIS to coordinate a variety of medical testing within the laboratory and throughout the hospital, and as general as an information database for a patient. Next slide, please. Along with the LIS, laboratories use several equipment, such as analyzers that incorporate computers, which control instruments, monitor its performance, and calculate analytical results in order to free up the lab technicians. So it can be clearly said that computers are a vital part of the modern medical laboratories. Next slide.
All right. Computers in telemedicine, remote diagnoses and treatment. Next slide, please. So for a brief history of telemedicine, medicine which is able to be done from afar, one of the earliest concepts was dated back to the late 1920s, where a German engineer, Hugo Gernsback, wrote about a machine that would allow doctors to not only see their patients from afar, but be able to manipulate and feel them to diagnose what's wrong with the patient. One leap towards this in recent years, in 2001, was the first fully remote surgery conducted by medical professionals in New York on a patient in France. And in 2004, there was a network system set up in Ontario, Canada, for patients to be able to call doctors and medical professionals about certain symptoms so that they wouldn't have to schedule a doctor's appointment. And this network was used to great effect in 2009 when it was able to track a gastrointestinal illness outbreak in Canada. While this technology was more seen as a novelty for current times, because of COVID-19, it has pushed many companies to make it a requirement and a necessity. Next slide, please. So in the realm of remote diagnoses, the way computers have contributed to it is in the sense of video calls, where a patient is able to connect to a doctor virtually and display the problems with them that they're having. It's easy to use because most clients know how to use video calls, since it's an integral part to our society. It lowers infection rate because patients are no longer required to go into an infected building full of other sick people. And it's actually a very cost-effective for both the care provider and the health insurer and the patient overall. The only problem with this approach is that examinations are only cursory, meaning that it's only a visual examination of the person, and it's not as in-depth as one would be in person. However, cell phones are being integrated into this process so that it is a bit more thorough. One example is a smartphone-enabled biosensor developed by OJ Bio, a joint venture company, in which users will be able to collect samples of bodily fluids and connect it to a device that will connect to the smartphone, which through an app will tell users, provide users feedback on what needs to be measured. Next slide, please. In the realms of remote treatment, because of the current pandemic, most, if not all, prescription providers provide home delivery, which many users are already able to use because of stuff like Amazon. So they know how it works. And around remote surgery, we are getting closer to the envisionment of the German engineer that envisioned this stuff back in 1925. However, it does lack critical funding at this time to be fully integrated. So it is still seen as a novelty, despite its many successes over the years.
All right. Hi, my name is Daniel, and I have the topic related to 3D printing of artificial organs and human tissues. So what I did is I chose to narrow it down to a new practice of 3D printing that uses patients' own cells to create these structures. Before, we used to use biocompatible plastics, but who really wants plastic in them? I don't, so we're using people's cells now. The most popular company that uses this method is called Cyfuse. They basically cultivate cells and allow them to mature by using a process known as Kenzen. Kenzen is a Japanese practice performed on flowers to keep them in place and erect. It's basically, if you see the top right corner of the picture, it's basically a bunch of spikes or wooden picks that hold the stem of the flower. It's used for decorative purposes, but the same process is used in this 3D software. So what they do is what the goal of this company is to print 3D cells, have them mature and have similar properties or mimic other people's cells that they've lost either through accidents or through it no longer functioning. For example, if they wanted to replace muscle tissue, they would want to use muscle cells, and they would want them to be able to compress and expand without tearing and having the same properties of muscle cells. There's two machines that they use, Regenova and S-Spike. Regenova is the one on the top left. It's bulkier in size, and I believe it was over 5 feet tall. While the other one, S-Spike, is more compact. Regenova has 3D design software to place these cells in particular orders on the spikes, on the needles, so that they can mature together. The needle diameter is much smaller on the Regenova. It's 170 nanometers. Oh, sorry, not micrometers. And this machine is ideal for recreating body and organs. S-Spike, on the other hand, is much smaller, compact, and best for molding unique shapes. Their needles are a little thicker, around 400 micrometers. So the process involved, the steps involved in this method is: one, the cultivating of cells. They extract cells and stem cells in you, and they allow them to grow and mature in order to be used by the 3D printing machine, which is basically step one is this picture right here. Step two is to layer them onto needles by the 3D data in the machine. So they know exactly, if they're creating a structure, they know exactly where to place certain cells. They rearrange them in this order with these spikes so that they can fuse together, as step three implies. So they grow and fuse together and mature better. Step four is you finally remove that little tray, the little needle with the tray, slide it up, and allow the tissue to mature even further. The final step is step five, where you have to check that the tissue manufactured is safe and efficient and has similar properties to what you're trying to replace. Here are the type of structures that they have worked on or are working on. Number one is heart muscles and vascular regeneration. They have come up with tubule-like structures that act like vessels that can resist up to 5 times normal human blood pressure and are flexible enough to expand and contract. With this, they can basically replace any veins or arteries that people might have problems with in the future. This also applies to the heart. Heart valve muscles have been created and have similar properties and have been replaced in people. So when someone's heart valve isn't working properly, they'll go in there and they'll replace it. Although they've done that much, they still haven't created a functioning human heart yet. But they do grow some for medical doctors to practice heart surgery on before they even attempt it. The next one is bone and cartilage. They use your own stem cells, mature them, and then transplant them into your bone tissue or your cartilage. What ends up happening is, as soon as it makes contact with similar cells, these stem cells mature into that particular component that you're lacking. So this actually can help out people with bone degeneration and cartilage deficiencies. As shown in the picture on the right, the cell gets transplanted into the bone, and then they fuse together to create bone and cartilage. If you need both, they will automatically create both. A very successful experiment that they have done is transplanting an esophagus into a rat. It was so successful that they actually retained every property it needed to, and they actually could not find the surgical line and couldn't tell what was implanted and what's actually part of the rat. So maybe soon we will actually have esophagus transplants to help out like people with throat cancer. The structures, the tubule structures actually could actually be used for the urinary system to replace tubules or urethras or anything that's damaged in that process. So it actually has high potential to be used in the urinary system as well. And we also have created liver cells and used them to make medicine using the S-Spike machine. So here's a picture of the tubule-like structure, and this is the process that they have done. So they take artificial vessel, implant it, and it actually holds up, and it has like resistance up to 5 times normal blood pressure. And then on the right, this is the picture of the transplant that they did on the rat. As you can see, you can tell the transplant's right here. And after a couple days, there was no way you could tell what's artificially implanted. So that is basically our report on medicine and computers and applications.